Good afternoon, class. Today we're going to be observing a teaching plan being set into motion. Today we have a nurse, a client, and her mother, and we're going to witness how a nurse teaches the client a psychomotor ability of how to check her own CBG. Let's watch.
Are you okay, Sue? Oh my god, Mom, no.
Hi, my name's Gurjeet. I'm a community health nurse. How are you feeling today?
Not bad. Thanks.
And how are you feeling today?
I'm fine. I'm her mom.
Okay, nice to meet you. Can I get your birthday and full name, please?
My name's Suyeon Bae. I was born in 2003, October 5th.
Okay. And Sue, today we're going to be teaching you how to check your blood sugar level. Do you understand why we're doing this?
Blood glucose monitoring reveals one's individual's pattern of blood glucose changes and in house and pattern when to eat, what to eat, and right time to take the medication. It also helps to how quickly my body is respond to high blood glucose or low blood glucose, which is called hyperglycemia.
Wow, looks like your teaching session with the student nurse was really effective.
Yeah, it sure was.
Wait there! Before Sue learns how to complete the psychomotor skill, she first needs to have the cognitive side of her learning completed. Let's watch as this student nurse teaches Sue and her mom the background of diabetes.
Hi, my name is Alyssa. I'm a student nurse from Langara.
Hi, my name's Sue.
Okay, nice to meet you.
I'm her mom.
Nice to meet you too. So today I'll be giving you some information on what type 1 diabetes is. Do you have any background info on what that is?
I just know that it just makes my blood sugar really high.
Okay, so for people who have type 1 diabetes, their pancreas does not produce enough insulin. So insulin is a hormone that lowers your blood glucose, okay? So if you don't have enough insulin, the glucose in your blood will be elevated, it'll be high, because it doesn't get taken up by the cells for energy. Okay? Do you understand that?
Yeah. Mom, this is very difficult to understand, and I feel like this is very boring.
Just listen.
Okay, I know this is very new to you and there's a lot of information that you need to understand. So I have here a pamphlet. It contains the normal ranges of the CBG, which is the blood sugar, and then it also has the signs and symptoms that you will feel if you have low glucose or high glucose, okay?
Okay.
I have some concerns. Does she have to poke herself? What about infections? Is it really necessary?
Okay, so as for infections, you wouldn't have that because we perform meticulous hand hygiene. So we wash our hands, we put in gloves, and then we alcohol swab the finger side that you're gonna poke.
How many times per day does she have to do it? She's really forgetful.
Yeah, I am.
Okay, so as per doctor's order, you will have to poke your finger 4 times. So that's before each meal, before breakfast, before lunch, before dinner, and then before bedtime.
I think 4 times is too much. What if I eat only 2 times a day and take my blood sugar 3 times?
So it's really important to maintain your diet and then eat every time of the day, every meal time.
I'll make you really good meals.
Sure you do. So, but I still don't get, like, why should I care about this?
So it's really important for us to monitor our blood glucose levels to prevent some complications.
What complications?
So those are the things that might happen, that might lead to it if we don't monitor our glucose levels. So it might affect your eyesight, you may lose sensations and feelings on your fingers, especially on your feet.
Her feet? She's in ballet. She needs her feet.
My feet?
And
So you need to listen. Okay, I really want to follow this schedule that you just gave me, and I just will be reminded by this pamphlet, right?
Yes, it has all the information that you need. Any questions?
No, this was very informative. Thank you.
I'm glad to hear that.
I'm ready to learn.
Okay, before we begin, I just want to remind you it's good to check your blood glucose level 30 minutes before you have any meal, so your mom can remind you. Also, try to use the hand you don't write with. So which hand do you write with?
I use my right hand.
So we'll use your left hand for today. Okay, before we begin, let's use some hand sanitizer. Here you go. And I'll also use some myself. So this is the machine you'll be using. It's called a glucometer. And these are the strips you'll be using. Make sure to check the expiration date. Any questions so far? Okay, so we'll put in the strip into the glucometer. Okay, and now we'll use an alcohol swab and clean the finger we'll be poking.
The left hand, right?
Yes. Okay, so we'll be cleaning it with an alcohol swab. And this is a lancet. This will be poking you and drawing the blood.
Mm.
Okay. You're gonna feel a little bit of a poke. There you go. And make sure to wipe the first drop of blood. Any questions so far?
No.
No, okay. And then you can press on your finger, that's called milking it, to get more blood. And make sure you put the blood at the edge of the strip, like that. Any questions so far?
Mm.
And then the blood sugar level will come up on the screen.
So, and what do I do with my finger that's poked?
So then you can use a gauze and apply some pressure.
Oh, okay.
Okay. And so once you're done with the sharp lancet, you can put it into a sharps container, like that.
Did it hurt, Sue?
So much.
So if you feel sweaty, shaky, or dizzy, your blood glucose level may be low, so it's good to check it using the machine. And it's good to drink some orange juice or eat some crackers if it is low. Do you have any questions so far?
No.
How was the demo for you?
I think I just want to go over one more time.
Okay, sure, we can try it again. Okay, ready to try
Yeah.
measuring your blood sugar?
Yeah.
Okay, you have all your supplies here.
So first of all, I will use my non-dominant hand, and I'll wash my hands first, like this, and I'll check the expiration date of the strip. Take one, put it in here after setting the machine, and I'll alcohol swab my finger, the one that I will poke, for 15 seconds and let it dry for 30 seconds. And then I'll poke myself and strip out the first drop of the blood and then milking out. Done, right?
Yeah, good job. And make sure to record the amount that you have on the screen.
Okay.
Okay, any questions? Good job.
As we saw, that was a successful teaching session. We taught Sue how to learn and be motivated to learn by giving her the right information. We used the return demonstration technique to allow her to learn the psychomotor skills, and we gave her and her family education and pamphlets and further resources so they can continue learning. And now Sue can live a sweet life as a ballerina.